sa ating kasaysayan sa buong mundo't sangkatauhan. Anuman sa buhay ang kinatatayuan, sa sakit na to
Walang audio, sir.
Sapat at tamang impormasyon ang kailangan upang ang COVID-19 ay ating maiwasan. Krisis na nararanasan ay malalagpasan kung ang lahat ay sama-samang magtutulungan. Sabon at tubig, bastong paghugas ng mga kamay, sa alkohol, mikrobyo ay namamatay. Bata man o matanda, lahat ating ihakay, na kung maaari ay manatili sa loob ng bahay. Kumain ng pagkain masustansya at pagbitamina din kung kaya. Ipagpatuloy natin ang mag-ehersisyo, matulog ng sapat, magpahinga at maligo. Magtakip ng tissue sa pagbahin o pag-upo. Kung wala namang tissue ay pwede din sa may braso. Remote at gadgets railing sa tupakan ng pinto. Mga madalas hawak ay disinfectant ninyo. Sabon at tubig, bastong paghugas ng mga kamay, sa alkohol, mikrobyo ay namamatay. Bata man o matanda, lahat ating ihakay, na kung maaari ay manatili. Kung maaari ay manatili. Kung maaari ay manatili sa loob ng bahay. Ngayong dumadami na ang may sakit, at lahat tayo ay naiipit. Kapatid, huwag bibitaw sa kapit, manalangin, magmahalan at magmalasakit.
Hi, good morning. Can you give me an idea more or less how many participants do we have now?
Unang beses sa ating kasaysayan sa buong
Yes po.
mundo't sangkatauhan. Anuman sa buhay ang kinatatayuan, sa sakit na to pwedeng mahawaan.
Good morning, everyone. My name is Marian Tadena from the PWU Undergraduate School of Nursing. I am thrilled that we are all here despite the struggles of online learning. So don't forget to comment your names in the comment section of the live stream as your attendance. This morning, the PWU School of Nursing initiated a very interesting topic that aims to supplement knowledge in maternal and child nursing. With the theme, Strengthening Next Generation's Health Through Maternal and Child Nursing, the PWU BS Nursing Level 4 students would like to present to you a nursing webinar entitled Perinatal Care Education in Times of Pandemic. As part of the university's objective to develop the students' personality and moral character, I would like to call on Ms. Marian Bagid to officially begin the program with a prayer. Then let us be gracious as we sing the national anthem and the Philippine Women's University hymn.
Let us bow our head and put ourselves in the holiness of God, the Father, the Son, and the Holy Spirit. Dear Almighty and ever-loving God, we glorify and thank Thee your name. You have showered us with so much blessings, and your presence continuously remind us of your faithfulness and guidance. With this, may we humbly ask you to shower our speaker today of your greatest inspiration so that she may share the most of her knowledge, heart and soul to her respective topic. May we also absorb the invaluable knowledge, experiences, and put it into practice what we may learn today. We pray that you bless all the committees in charge that they may be able to fulfill their tasks responsibly, that the objectives they have set may be achieved. Your infinite blessing would mean the success of this webinar. May we be living witnesses of their genuine love through the enactment of the knowledge acquired through this activity. We ask this in the name of Jesus Christ, our Lord and Savior. Amen.
Thank you, Ms. Marian. Let us have Ms. Angelique Piscay, DSN Level 4 student. Thank you, Miss Marian. Once again, let us have Miss Angelique Biscay, BSN Level 4 student and the event chairperson for our opening remarks.
Thank you, Ms. Tadena. To our Honorable PWU President, Mr. Marco Alfredo Benitez, to the Vice President of Academic Affairs, Dr. Felina Young, to our dear guest speaker, Mrs. Balbina Borneo, to our dear School of Nursing Dean, Dr. Minerva de Ala, to the Honorable PWU Deans from the Allied Health Schools, to our beloved nursing professors, to all guests participating from different institutions, to our fellow students, ladies and gentlemen, good morning. With a joyful heart, I am very happy to welcome you all. We know for a fact that pregnant women are among the vulnerable groups, and this vulnerability is being heightened by an emergency situation that we are currently facing today. In the midst of COVID-19 pandemic, these groups are into difficulty, facing enormous barriers in accessing basic and complex interventions. May it be physical, financial, and communication barriers, as well as the obstacles in observing quarantine measures. Obviously, nurses are also struggling to provide sufficient care for pregnant women, with the challenges of accessing prenatal services that are suspended or reduced. These concerns lead to amplified stress to pregnant women and also to our nurses, and could even affect the quality to provide care. That is why we would like to highlight in this lecture the concerns of pregnancy and how healthcare providers, especially our nurses, respond in this time of pandemic. So, listen to our distinguished guest speaker, jot down notes, and be inspired. Once again, good morning and thank you.
Thank you, Ms. Angelique, for that warm opening remarks. I hope everyone is now finally wide awake and excited that we are closer to our lecture proper. Please be reminded that if you have any questions or concerns on the topic, we will entertain your questions right after the lecture during the open forum session. Everyone will have the opportunity to submit their text questions to today's presenter by typing your questions into the comment section in live stream in the official PWU Facebook page. You may send in your questions right after or during the presentation, and then we'll collect these and address them during the Q&A session at the end of our lecture. Now, to present to you our guest speaker for today's lecture, let me call on Ms. Cristina Aroza, BSN 4 student and past nursing execom president.
Good morning, everyone. It is my privilege to introduce to you our speaker for today's webinar. Our speaker graduated of midwifery in Balian Community College and Bachelor of Science in Nursing in Arellano University. She took her advanced degree in Master of Arts in Nursing in University of Santo Tomas. She earned various awards in academia, including College Leadership Awards, and received her nursing specialty certification as Registered Nurse Clinician 1. Our speaker has more than 40 years of working experience as a researcher, midwife, nurse assistant, supervisor, head nurse, professor. She is a graduate school professor and the physician liaison officer, medical director's office in University of Perpetual Health System Delta. Today, our speaker will share her insights and experiences in prenatal care. Without further ado, ladies and gentlemen, please join me in welcoming Mrs. Balbina Borneo.
Thank you, Ms. Cristina Arosa, for your kind introduction. Good morning to each and everyone. I am honored to be invited as speaker to your prestigious university and to talk to your thousands of students, faculty on a webinar topic, Perinatal Care Education in Times of Pandemic. And I would like to congratulate ahead the organizing committee chaired by Ms. Angelique Biscay and officers of College of Nursing, the millennials of the nursing profession, and the future leaders and the future frontliner on this perfect timing update using the new technology of webinar. I really appreciate and I have a high regard to all your faculty, especially the advisor, Ms. Dorol and Ms. Emmy Macaraeg, under the leadership of your Dean, Dr. Minerva de Ala, because you were able to put into action and provide your students with opportunities to be taught and honed and to lead in a vibrant learning activities such as like this webinar in times of pandemic. With much appreciation with the administrators at the Philippine Women's University, the President, Mr. Marco Benitez, Dr. Pelina Siyang, Senior Vice President for Academic Affairs, and Dean Minerva de Ala, School of Nursing, for maintaining a top-performing tertiary educational institution since 1950. And so to start with my topic, and as a speaker, I would like to start with the questions instead of using objectives or disclaimer to answer your stated objectives in this webinar. So to start with, what are the 12 common questions to answer about COVID-19 pandemic in relation to perinatal care education in times of pandemic? Because maternal and child care has been derailed due to coronavirus, and advocates warn the outcomes and could be disastrous. So, does COVID-19 impact pregnant women differently? Should pregnant women take extra precautions during delivery? Are these risks of transmitting the virus from mom to infant during birth vertically or horizontally? Can a baby be infected from breast milk after giving birth? Are symptoms different in pregnant women? Should families change their labor and delivery plans? How are pregnant women being screened for COVID-19? What should you do if you are pregnant and think you have a COVID-19 in preparation of giving birth? What should you do if you're pregnant diagnosed with COVID-19? Should families, women changing their eat or drink? How will a COVID-19 affect prenatal and postpartum care visits? How will the pandemic affect prenatal and postpartum care long term? And to give you an overview about perinatal care, is it the care of a woman and a future or newborn given before, during, and after delivery from 28th of gestation through the 7th day after delivery or even 2 weeks? So, while prenatal care is often deferred as the time before birth. So what is perinatal care and why it is important? Because perinatal care is important during pregnancy, and prenatal care help prevent complication and inform women about important steps they can take to protect their infant and ensure a healthy pregnancy, as well as reduce the risk of pregnancy complication. So what are the most important stages of prenatal development? Of course, the germinal period begins with the conception and ends with blastocyst. is fully implanted in the uterine tissue. And then next is the embryonic period, lasts from implantation to until 8 weeks of the time of conception. Why I am saying this? Because this is the most crucial period of prenatal development. That's why there is a doctor who is a perinatologist. So perinatologist or maternal fetal medicine, a specialist who play a number of roles in the care of the complicated obstetric patient, from performing imaging and prenatal diagnosis to consultation concerning vaccine or unusual medical or obstetric problems. So for the interest of our students to differentiate between the obstetrician and gynecologist, obstetrician are training in surgical procedure to deliver babies and to treat condition involving the female reproductive system, while perinatologist, a subspecialty of obstetrician, and a physician who is a specialist in high-risk pregnancies and the care of the fetus that is experiencing complication. The same as our nurses. As all of us are nurses, but we as an MCNAP, we are a specialty organization specializing in MCN or maternal child nursing. And to give you an update to all hospitals, especially Dr. Jose Pabella Hospital, so even big maternity hospital, Pabella are not spared in the coronavirus. And to our government, especially DOH, the status during this event, impact of COVID-19. How can we help ensure responses to this pandemic to take into account their specific concern, the needs of the pregnant mothers during delivery while giving birth? The COVID-19 pandemic has upended the lives of millions of people globally, especially those of displaced pregnant women and newborn, and already struggling to access to the most basic health services. The current crisis severely impacted displaced on their livelihood, and many have been, and whatever is small income, disrupted by curfew, lockdowns that restrict their free movements. And for almost 6 months, March 15, 2020, start of lockdown, every day became a problem. DOH COVID report, pataas ng pataas ang COVID, and most of the hospital had difficulty on admitting patients, and some hospitals are closed because of contamination, and worse is refusing of patient on admission, especially the pregnant women. Kaya kung kayo ay updated sa mga news today, marami or nakikita nyo sa news, nakaka-experience kahit saan napapaanak ang mga pasyente. Na, I don't know if you are updated with the news, nurse nagpaanak sa kalye, sa tulong at sa pakiusap ng barangay, mga nanganganak sa bahay. Example is Max Collins. Siya ay nanganak sa bahay dahil takot siya sa punta ng hospital. Well, the most controversial is, I hope some of you can still remember, Senator Coco Pimentel bring her wife to Makati Med because of for delivery. The question is, he breaks the protocol. Probably, maybe at this time you have an idea that he breaks the protocol, being a positive as a COVID infected. If you are a first-time pregnant mother giving birth at a most unusual time in the middle of the pandemic and during lockdown. And you have no idea of thinking everything else is reducing or totally eliminating our risk of exposure to the coronavirus. What most I wish to highlight is how the coronavirus affects their expectation of what birthing environment would be. And I hope all of you are having this and updated with the different protocols. So challenges and problems encountered on giving birth on this pandemic, COVID-19. So with the challenges on the personal matter, financial, lack of preparedness, fear, stress, anxiety, and discrimination. Financial, maraming nawalan ng trabaho, tirahan, restriction of movements due to lockdown and curfew. Lack of preparedness due to no work, no pay, no savings or less savings. Establishments are closed, bank, schools, supermarket, offices, and now the lack of access to consult because of a limited hours to doctors' offices because of a close and of this institution, the the COVID pandemic is having profound health and socio-economic impact. No more than 80 countries around the world as government enact lockdowns and quarantine measures. Many people are shifted to working from home, schools shut down, and businesses shelters their doors, unsure of when and if they will be able to reopen. But the government, especially our health system and health institution, it is a time to ensure that these services are not interrupted. And to give you an update, as of June 26, 2020, CDC, a total of 8,207 cases of COVID-19 in pregnant women reported to CDC. So prevention of COVID-19 during pregnancy should be emphasized for pregnant women, and adherence to these measures need to be addressed. So now, can a mother with COVID-19 pass the virus to the baby in the womb? I would like to discuss the two possible pathways of transmitting COVID-19, which is the horizontal transmission viruses are transmitted from individuals of the same generation. Well, two research papers published March 26, 2020 describe findings coronavirus antibodies in 3 newborns of mother with COVID-19 infected. They have been exposed, and the result of this study earlier found no evidence of COVID-19 in amniotic fluid or cord blood of 6 other infants born to be infected of pregnant women. So far, data on COVID-19 does not suggest pregnant women are at high risk of getting the virus, according to ACOG. ACOG is Association of American Obstetrician and Gynecologists. However, we have seen the flu, at a greatest risk of harm if they get exposed to respiratory infection. So what about the vertical transmission? While the research paper include only a small number of cases, a lack of vertical transmission from the mother to child in utero would be consistent with what is seen with other common respiratory viral illnesses in pregnancy, such as influenza. But in cases, it is believed that the mother, the family members can be transmitted the infection through close contact. The virus can be transmitted through cough, sneeze, which could be spread virus through laden droplets. I will not discuss anymore what is laden droplets. So in general, transmission of viruses can occur through two pathways, the horizontal and vertical. Again, vertically transmitted infection is caused by pathogen. It can occur when the mother has a pre-existing disease or become infected during pregnancy. So another research is in the UCLA, the University of California, Angeles Medical Center, Dr. Yalda Aspar, an obstetrician, is proving COVID-19 impact during pregnancy. Her own baby is about due this coming October 2020. And being an obstetrician, hears a lot of worries every day from her patient. Example, will COVID-19 hit me harder because I'm pregnant? If I'm infected, will the virus damage my baby? Dr. Yalda, an obstetrician at the same time in Ronald Reagan University, California. Data on pregnancy and COVID-19 are woefully incomplete, but they offer some reassurance. Fetal infection later in pregnancy appear to be rare. And experts are cautiously optimistic that coronavirus won't wrap early during prenatal development. That's because of a pregnant women uniquely adjusted immune system. If you can still remember the immunoglobulin, and partly because the coronavirus points of attack is the lungs and the cardiovascular system. So while 200 million pregnant women worldwide are at risk, but not all these 200 million pregnant women are infected. In the Philippines, I have mentioned over 8,000 cases of pregnant women infected with COVID. So on this COVID-19 pandemic is critical to the access, especially in family planning services, should be remain available while keeping healthcare providers and their patients safe and continue to access and assess the needs for family planning services related to preventing or achieving pregnancy and highlights the special needs of adolescent pregnancy patient. I hope, again, be updated. The latest in family planning as per CDC reported teenage pregnancy is now again on top of this. So I would like to emphasize on this particular what is COVID-19. This is a virus. The most common symptoms are definitely you are aware that headache, muscle aches, fever, diarrhea, cough, shortness of breath. And symptomatic pregnant women with COVID-19 are what we call this with clinical criteria. At least two of the following symptoms: the fever, the chills, rigor, myalgia, headache, sore throat, new olfactory taste disorders, and at least one of the following: cough, shortness of breath or difficulty of breathing, and severe respiratory illness with at least one of the following evidence of pneumonia. That's why you will notice, especially the patient with pneumonia, again, sometimes at this point in time, kawawa naman yung may mga respiratory problem para bang again, especially pneumonia, parang suspected agad sila with COVID. So this time we have to consider healthy lifestyle for our pregnant mothers. By protecting, advise them to increase physical and mental resilience by eat nutritious and well-cooked food, drink plenty of fluids, avoid alcohol and beverages, increase the body resistance by having adequate and at least 8 hours of sleep, exercise regularly, and take supplements or vitamins, and maintain a healthy outlook and be positive. So I would like to give you approach to care the mother who is COVID positive symptoms of or with suspect infection. So fetal and uterine contraction monitoring when appropriate or based on gestational age, individualized delivery planning, multidisciplinary team-based approach. So it should be presence or with the presence of infection disease and pulmonary critical care and pediatric specialists. So full PPAs as per guidelines for all healthcare personnel involved in the delivery process, especially in resuscitation of newborn. You might heard that if you are even on the first attack of COVID-19, millions of charges, especially if you will be hospitalized because the team, eto yung malaking issue nga na all the PPEs are always charged to the patient. So be careful when the baby needs resuscitation, intubation room, or mass ventilation, as these are aerosol generating procedure. It is recommended to move baby in an incubation. So avoid close contact with the mother soon after birth. Another chains of protocol is this time skin-to-skin contact are not given. So delayed cord clamping should be done as per protocol. If the mother is not symptomatic, the baby can be roomed in the mother with a safe distance of 6 feet between the bed and the crib, except while feeding and during cases the baby should be in a crib. And at least according to the CDC, with a curtain. So 6 feet with additional curtain. So limit the visitors or no visitors policy. So elements of prenatal or birth preparedness. Birth preparedness involved not only the pregnant women, but also the family, the community, and available health staff provider. The support and involvement of this person can be critical in ensuring that a woman can adequately prepare for delivery and carry out a birth plan, because life-threatening complication can occur during early pregnancy, postpartum period, especially during pandemic. So, and pregnant women individuals in particular are encouraged to take an available precaution to optimize health and avoid exposure to COVID-19, including maintaining your prenatal care and wearing masks and other recommended washing hands frequently, maintaining, as I've mentioned, physical distancing and limit contact. Attending antenatal care or at least 4 times during pregnancy, because normally you have this checkup 14 times the whole 9 months of pregnancy. So identifying skilled provider and making a plan for reaching the facility during labor, setting aside personal funds to cover the cost of traveling and delivering with a skilled provider, and any required supplies, recognizing signs of complication and knowing what community resources, emergency transport, funds, communication, especially in case of emergencies, and having planned for emergencies, example, knowing what transport can be used to get to the hospital, setting aside funds, and identifying person to accompany to the hospital or to stay at home with family, and identifying a blood donor. So what are the different types of childbirth that you can suggest but not recommend? I'm saying or emphasize recommend because it depends on the needs or the present situation of the pregnant women. They can be in vaginal birth, scheduled cesarean section, unplanned cesarean section, or vaginal birth, or your C-section, the VBAC, or scheduled induction of labor. And you can, let's say, have these methods of childbirth. I understand this was discussed during your MCN lecture, the Decreed method, Lamas, Bradley method, Laboyer's method, or even what we call this, the doula, with the help of the doula. I mentioned to you that the artist GMA, si Max Collins, water birth delivery at home. My goodness. Well, I understand because Max Collins' husband is a nurse. But as much as possible, we will not encourage water birth delivery at home. I believe meron siguro siyang private obstetrician during birth, especially Max Collins, what I know. She's a first time mom, so first delivery. So of course, I am not questioning the type of deliveries. I emphasize on this, the type of deliveries of a mother or a patient. It's up to her. But what I'm emphasizing is the safety and hygiene, or what you call this, especially on the part of the baby. At any rate, embracing the new normal in childbirth. I like this portion because this is the new normal. Probably this is not a new normal at this time because we are almost on 6 months. So life as we know, it is truly unpredictable. And with the present pandemic, the whole world is experiencing right now. No one was truly prepared for it. The things we take for granted are now the things we hold on to. The safety and hygiene is now our concern. Needs have changed, so as our priorities. So in this new normal, technology now plays a major role in our lifestyle. Pre-pandemic time, how we took for granted the digital innovations such as contactless, online payments, current mobile devices, broadband speeds, and other modern digital technologies. So telemedicine has a silver lining for pregnant women during COVID-19 because telemedicine is already endorsed by the ACOG, or American College of Obstetrician and Gynecologists. As the coronavirus pandemic spread through Wuhan, China in early 2020, pregnant women faced new risks of hospital and began to run short supplies. In the US, some hospitals started limiting visitors during delivery to reduce the chance of spreading the disease. So do you really need a telemedicine app? The following services providers can benefit from telemedicine app development because 80% nowadays, even here in our institution, the Perpetual Medical Center, Las Piñas, we are using telemedicine of healthcare. So the executive says telehealth is important to their organization because of the different services: diabetes care, cardiovascular disease management, rehabilitation, prenatal care, family health care, pediatric care, cancer care, medication management, lifestyle modification. How I wish to mention one institution. Well, it is because probably, all hospital are on these updates. But I can see some institution, even the laboratory, sa parking pa lang, they can extract blood. So as the COVID virus wreak havoc with the healthcare system, telemedicine is stepping up in the spotlight and help the healthcare services. Telemedicine is making a very positive contribution to healthcare during the pandemic and is being used in a variety of ways in a prevention of the spread of COVID-19. Here, the virtual prenatal care because of home confinement and limited human interaction, we all have relied on technology. So, booking checkup online, birth planning, having plan in place for birth can help ease feeling of anxiety. Online consultation are the new normal. Consultation, prescription, laboratories, and more, and without going to the hospital. Sa ating mga midwife, alam ko may mga midwife o mga nurses na mga merong lying clinics, even in the community, because I think, especially the Quezon City, if you are exposed in the community, may mga lying in. It is required, supposed to be, na ang lahat ng community ay merong available lying in. So I suggest adapt the new normal dahil parang ito na ang normal. If not, mukhang matagal ang pandemic na ito. So conduct virtual prenatal care. In fact, you can have an independent practice or business by using virtual. To give you an example is yung mga gym. Di ba? Ang mga gym ngayon, nagkaroon sila ng ideya na through online. So, online health education, online classes, online pregnancy birthing class, online pregnancy exercise. So, like stretching, breathing exercises, because MCNAP started digital e-learning since 2 years ago. During the time, 2 years ago, when I was still a president, through our partnership with Johnson & Johnson, we give lectures to our nurses. We visit, because MCNAP have 31 chapters all over the Philippines. We give lectures to our nurses in NICU, PICU, Pedia Ward, OB Ward, even mother's class. So, ito yung pinang-a-update namin na dapat ang mga nanay na i-inform through education on how and what to prepare during delivery or during pregnancy. So, what should I expect during delivery? As I have mentioned, hospital are limits or minimize person-to-person entering the hospital. Hospital do the screening or medical staff and patient with swabbing. Take note. I think another protocol that must be present is to protect everything. I know this is a little bit costly. A pregnant woman must have a 2-week swabbing before the due date. Because to protect, I would like to share, I don't know, but of course, I don't like to rely probably unless I have seen. But confirm, most of our patients or doctors affected by COVID, if you are updated, mostly are infectious pediatrician. Have you heard that? And I know you're updated. And mostly are, what they call this, anesthesiologists. Why? Because these are most of the doctors who have a direct contact and we don't know, because there are some patients, not only I mentioned the symptoms, but what about asymptomatic patient? So check temperature. This time, I would like to say, pag may lagnat ka, concern ng buong barangay. Dati, pag may lagnat ka, inom ka lang ng tempra or analgesic. Pero this time, everybody cares if you are having fever. Alam ng buong barangay because there is a contact tracing. Nung araw, ika nga, pag naghatching ka, sneeze, bless you. Ngayon, pag maghatching ka, iiwasan ka ng buong barangay or ng buong kalapit mo. So, no visitors policy, no mask, no face shield, no entry, even in any establishment, including your contact or details. So, as much as possible, expect faster discharge from the hospital to limit the exposure to COVID infection. So, deliveries, after pagkapanganak, pinakamatagal na yung 8 hours. To cesarean section, 2 days. So, in 24 hours, kailangan ma-discharge. So, with this, I think I have, lastly, in conclusion, we have to be compassionate and understand each other's situation, as it is that healthcare professionals together with the family, the community, and the members are doing their best. So I think that's all for my presentation, and these are my references. Thank you for listening.
Thank you, Mrs. Borneo. That was quite an interesting lecture, and I hope we all took the advantage of absorbing all these information that we can actually apply and share when we are in the actual settings, whether it be clinical, academe, or community. Now, for the next part of the webinar, I would like to call on the co-chairperson of this nursing webinar, Ms. Heidi S. Bakani, to be the moderator for our Q&A session. Ms. Heidi?
Thank you, Ms. Marian Tadea, and thank you to our wonderful speaker, Mrs. Balbina Borneo, for that very educative and informational lecture regarding perinatal education in times of pandemic. So good morning, everyone, and thank you for participating with us for today's webinar. Before we get started, I'd like to go over a few items so you know how to participate in the question and answer forum. To give our attendees the opportunity to find out more about the topic and interact, we will now proceed with the most engaging part of this webinar. So viewers from the live audiences in PWU's official Facebook page live stream can now send their questions. You will have the opportunity to submit your questions to today's presenter by typing your questions into the comment section. You may send in your questions starting right now, and we will collect these and address them to our guest speaker, Mrs. Borneo, to answer. So I encourage everyone now to go ahead and you may start submitting your question. To prime up the pump, question would come from so Mrs. Borneo, my question is, what can you say about the new CDC report released just this week that concludes COVID-19 triggers premature birth in infected moms? They have done this week using data from March to August, used 598 women and 445 live births from that 598 women, where 12% of these resulted in premature births, including miscarriage and stillbirths. It was released in the CDC Morbidity and Mortality Weekly Report.
Okay. As I have mentioned in my lecture, it's too early or premature to determine if that is really COVID-19 is caused. Well, you have mentioned cause prematurity. Definitely, there is a pre-existing um, uh, or intervening complication, probably. That's why there is. Because if you are a COVID patient, ahead, definitely, hindi naman, ang COVID naman kasi, meron niyang symptoms eh. So, ikino-compare ko lang to make it understanding, hindi ka agad, aside from this, separate yung ikaw asymptomatic. Okay? But even though you are asymptomatic in relation to prematurity, okay, if you are the cause of this COVID-19, I believe, because I have a lot of research, hindi nagkakaroon ng prematurity kung ikaw ay COVID. Probably meron ka ng impending cause of your prematurity. I have mentioned because the attack of COVID is more on respiratory and cardiovascular. So I think they have to get a deeper research kung ang cause ng prematurity ay COVID. So I have an experience. Prematurity, siyempre, 7 months of pregnancy. So sa tingin natin, lahat tayo ay nag-MCN kung may prematurity. What trigger the prematurity? So nagkaroon ng contraction, di ba? There is an possible delivery. So prematurity for me, I doubt, definitely. There is a research na it's too early. Ang COVID kasi March. So kung ganong kataas, as they have mentioned on research, baka meron pang ibang causes kung bakit nagkaroon ng prematurity. Even wala pang COVID, marami na tayong cases of prematurity. I have mentioned that infected mother na nga, walang nakita sa amniotic fluid, even in umbilical cord, wala pang masyado. I don't know this time. I remember March, right after this pandemic, I think early January, nagkaroon ng cause. Nagkaroon ng meeting, pinatawag kaming lahat ng president ng association, PPS, what you call this, the PPS is Philippine Pediatric Society, Philippine Society of Critical Care Newborn, and especially the Pabella, all hospital, taking up the statistics of infected cases of newborn. Marami talaga. But then, supposed to be, I would like to relay, if you can still remember, hindi ito bago. I will consider this sa HIV. If you can still, i-relate ko din yung cases ng COVID sa HIV. Bihira, nagkaroon ng maraming HIV because same as with SARS, HIV, virus din ito. And virus can, yes, can pass through the bloodstream, but then even the HIV, except yung isa na controversial na may HIV, namatay yun sa isang hospital, I will not mention the name, for data privacy purposes, pero hindi nagkaroon ng infection. So to answer for me, on my opinion, I think prematurity is too early to say ang cause ay COVID-19. But kung yan yung cause ng statistics as what you have mentioned, I think there is a pre-existing condition. That's why merong mga cases ng prematurity in times of COVID-19. Did I answer? I hope I answered the question. Hello?
questions that are coming in. Let's just stand by and be patient while we're having the IT fix some technical difficulties, all right? Thank you so much, everyone, for being patient and waiting with us. So how about we take a break for a while, shall we? So how would everyone feel about listening to good music after a good lecture? Sounds wonderful? Great. So everyone, let's give a round of applause for our friend from the PWU School of Music, Mr. Loisy Mercado, to sing I Have a Dream.
a dream, a song to sing, to help me cope with anything. If you see the wonder of a fairy tale, you can take the future, even if you fail. I believe in angels, something good in everything I see. I believe in angels, when I know the time is right for me. I'll cross the stream. I have a dream. I have a dream, a fantasy to help me through reality. And my destination makes it worth the while, pushing through the darkness, still another mile. I believe in angels, something good in everything I see. I believe in angels, when I know the time is right for me. I'll cross the stream. I have a dream. I have a dream, a song to sing, to help me cope with anything. If you see the wonder of a fairy tale, you can take the future, even if you fail. I believe in angels, something good in everything I see. I believe in angels, when I know the time is right for me. I'll cross the stream. I have a dream. I cross the stream. I have a dream.
Okay, we are so thankful that everyone is still here with us. Let me just continue on with the Q&A session. Okay, so this one question right here is from Miss Donabel P. Barrios, Mangali. Now, since suctioning is an aerosol generating procedure, Is it still advisable to do suctioning on a newborn after the delivery? And what are the other options to remove any secretions on the newborn? She says, thank you.
Okay, so what a nice question. Remember, I discussed the what they call this, the during the time that the mother is infected with COVID, so suctioning with aerosol is advisable, especially if right after delivery. That's why we have an APGAR score, right? Kung ang APGAR scoring plus the patient is, the mother is a COVID positive, definitely that is one of the advisable in the presence of the pediatrician. Now, remember, no, at this point in time, still, I will emphasize that COVID for the baby, of course, you have to observe the breathing, right? So, hindi naman siguro kailangan kasi na isaction. Definitely, there is right away oxygen in terms of natural na nagkaroon agad, umiyak agad yung baby nyo. So kapag hindi umiyak, ibig sabihin you have to assess the baby. So hindi siya umiiyak, ano ang condition. So because of the secretion, automatic you have to suction. But as much as possible, suctioning, even if the patient is in ICU, wag mo na agad suctioning yung ano. But for the baby na hindi makaiyak agad, definitely, unang ang pinapalo, pero hindi na uso ngayon yon. Pero, siyempre, we have to assess the baby pa rin. So, suctioning is necessary kung hamper yung kanyang breathing. Ika nga, delayed yung iyak because of the secretion. Okay?
Okay, ma'am. Thank you po. Next question from Miss Nellen Ravenna. We have, how a positive mother perform proper breastfeeding for her baby? Will there be a tendency of infecting the baby by positive breastfeeding?
Okay.
That's a very interesting question.
What a nice question again. Still, the CDC, the WHO, and including the DOH, still breastfeeding is advisable as long as there is a precaution between the protocols, no? So example, ano ba yung mga protocols natin? So the mother must be in wearing a mask, as much as possible, face shield, hand washing. So breastfeeding is still a gold standard for our baby. Breast milk as the best food for the baby. Remember this, andun pa rin yung another antibodies na ipinapasa ng nanay, which is the immunoglobulin, di ba? Yung colostrum. Ito yung protective materials, protective antibodies ng baby. So, I don't know, pero until now, meron pa ba tayong wala pa naman akong nakita na baby or what you call this issues na ang breast milk ay contaminated ng virus. So, still, doon pa rin tayo sa mga precautions or protocols. So, to protect the baby, continue breastfeeding pa rin. So, yung benefits ng breast milk ay importante at this point in time na ang antibodies ay naandun lamang at maibibigay ng isang nanay sa pamamagitan ng pagpapadede. I think that is the best for the baby.
Next question po, ma'am. From Puso Malaya. What are your insights regarding water birth in a facility nowadays?
Okay, what a nice question. I have mentioned Max Collins as much as possible, water birth delivery. I have this advice or on my insight, wag muna water birth delivery. In the hospital, kung yan ang trending, limited lang ang hospital na ano ng water birth delivery. So yan yung usually I saw this in St. Luke's, pero bihira ang nagwo-water birth delivery. And ako, as much as possible, hindi ko i-encourage ang water birth delivery. Maraming condition na kailangan na andon. Kailangan may nag-a-advise, merong pediatrician, merong obstetrician na present sa water birth delivery. So, and it must be safe kung sa hospital gagawin. Pero water birth delivery during home, siguro hindi para sa akin advisable.
I see. Thank you, ma'am. We actually had a question from a professor from PWU, but it looks like you have already answered the question. It was from Professor Lucena. Let's see. We have one more question. Can you comment on becoming COVID positive of pregnant mothers during prenatal visits? And what can you suggest to prevent this?
Again? Kindly repeat the question.
Oh, yes, ma'am. Can you comment on becoming a COVID positive of pregnant mothers during their prenatal visit? So what can you, I guess, advise to COVID pregnant mothers during their prenatal visits? And can you suggest how to prevent this?
Okay. It's a nice question again and issue. So that's why it is very important that education, information to our pregnant mother, if she is positive and to undergo prenatal, we will not, of course, be what you call this, hindi dapat mapipigilan siya na kung COVID positive siya ay hindi na siya pwedeng mag-check up. The more na dapat binibigyan ng opportunity ang ganitong klase ng pasyente natin na ang nanay dapat maging alerto na kung siya ay may sintomas na ng positive COVID or even the mild symptoms. Siyempre, hindi naman agad yan COVID agad na andyan, that's why I mentioned yung cough, andyan yung fever, definitely muscle ache or even short or cough. So dapat doon pa lang ay naiintindihan na ng mother na ikino-consider lalo itong mga establishment o lying in o na magkukonsulta online consultation agad. Why I am saying online? Kasi siyempre pag gano'n na ang sintomas, so affected na yung doctors. As much as possible, doctors, even here in our hospital, yesterday I asked our protocol, being in the office of the medical director, ma'am, kapag ang pasyente, sabi ko, doc, we have to inform our patient ano ba na ang latest. So aside from this na meron kaming telemedicine, so doon dapat alam na ng mga pasyente na kung sila ay may sintomas, telemedicine na. Kaya hina-highlight ko na dapat online check-up. Kasi paano naman yung mga doktor natin? Alam na alam ninyo sa statistics natin na ang mga frontliners is affected by some of the patients who are not honest in telling. Napakadami ng pediatrician natin na namatay, which is so much, even me are affected and emotional na infectious pediatrician magkakaroon or affected because of this. Kasi yun na nga hindi honest yung mga nanay. Nasasabihin, eto na po ang nararamdaman namin. So, yun yung importante, information dissemination, education na dapat ang mga nanay. Kaya nga, I believe this is the new normal this time. Kasi yun namang mga nanay, siyempre sa takot nila, hindi nila alam na, eto na pala, may sintomas ako. Ang ironic dito is they have to consider that there are two patients to consider. If you are a pregnant mother, your baby and the mother. So affected the frontliner. So kapag ang frontliner din ay lahat naman at hindi ang mga nanay ay COVID, tapos pupunta sila sa hospital, paano na ang ating mga doctors? Huwag natin bawasan ang mga frontliners because of this infection or contamination or hawahan. Kaya dapat susunod tayo sa mga protocols. In fact, kita nyo, distancing lang. So, dapat 6 feet. Nasusunod ba? I have to be honest. Common na ngayon. In fact, sa UP research, may mga ibang strain na inilalabas. Parang hindi mo alam sa hangin ba? O sa kalye ba natin nakukuha? Even hand washing, di ba? May proper. How many minutes ba? How many seconds? So, yung mga ganon, no? So, dapat talagang ikinoconsider na hindi dapat naman magkakaroon tayo ng problem kung ang pregnant mother ay prenatal, dahil sa COVID, dapat the more na alagaan natin. As you have mentioned, baka dyan, sabi nyo nga, nalaman nyo na may prematurity, and I doubt kung ang COVID ang cause ng prematurity. Definitely may existing na yan, problem in terms of labor or pregnancy. Okay?
All right. Thank you, ma'am. Before we finally close the forum, we just need to answer one more question, if you don't mind.
Yeah, sure.
From Miss Jocelyn Libao. What happens to the baby after delivery if the mother is positive in COVID? Is there any complications to the baby? Will there be any complications to the baby right after?
Okay. If the mother is a COVID positive during delivery, that's why I told on my lecture, there must be a multidisciplinary team present. The critical care pediatrician, the infectious doctors who will handle if there is really a symptomatic, both on the mother. Definitely, I mentioned if the mother is positive, siyempre, kailangan na andun yung infectious precaution. So, lahat nakamas. So, dapat, including the staff. So, ang baby, kailangan lang naman definitely observation din. A critical observation on both sides. Pero sabi ko nga, andun dapat lahat yung team na dapat kung aware na positive, andun lahat yung kailangan mga doctors or specialists who will handle the situation. Because I mentioned there are 2 patients to consider in this time of delivery.
Okay, thank you very much, Mrs. Borneo, for that very enlightening session. And thank you for sharing all the knowledge that you've given to us today. And thank you, everyone, for still being here. Okay, so let's see. Now it's almost time to end our program. It is my honor to call on Professor Marilyn Durol, our current BSN for Intensive Nursing Practicum instructor, to award the certificate of appreciation to our guest speaker. Ma'am Durol.
In behalf of Dr. Minerva de Ala, I am honored to award this certificate to Mrs. Balbina Borneo for sharing her knowledge and expertise in the perinatal care education in times of pandemic in this nursing webinar. Given this 30th of September 2020, PWU School of Nursing, signed Ms. Angelique C. Biscay, the event chairperson, yours truly, Professor Marilyn Durol, the clinical instructor in charge. Thank you, ma'am.
Thank you.
Okay, thank you, Ma'am Durol. This has been a successful event and a productive morning, don't you think, guys? So to officially close this successful webinar, let us hear from Ma'am Durol again for her closing remarks.
To our beloved Dean of the School of Nursing, Dr. Minerva de Ala, to our clinical coordinator, Ms. Emmy Macaraeg, to our honorable guest, Ms. Balbina Borneo, to my fellow faculty, to our PWU community, and to all the participants of this event, a pleasant morning. The season of teaching online is indeed challenging for experience restriction and limitation. What we are facing right now may be dark, painful, and difficult, but there is always hope for us. Remember that the stars shine brightest when the night is dark. Let not our anxieties or worries sway us from hoping, from trusting that better days are coming, as it was assured and declared in Isaiah of the rewards of a hopeful heart. But those who hope in the Lord will renew their strength. They will soar on wings like eagles. They will run and not grow weary, and they will walk in faith. It is a great honor for us to have this valuable opportunity to speak and hold in this webinar. We hope that this webinar was able to reach out and support you and give you hope. On behalf of the organizing team, the graduating BSN class of 2020, I would like to thank you for taking part in this webinar. To my graduating students, that so long ago you were with me in learning obstetric. Not far from now, you will change the lives of many. Thank you for making this webinar a success. In closing, I wish to share a quote. A wise physician once said that the best medicine for humans is love. Someone asked, if it doesn't work, then what? Then the physician smiled and answered, then increase the dose. Stay safe, and may God bless all of us in this health crisis. Thank you.
Thank you, Professor Durol. This concludes the program. So let's congratulate all the fourth-year students for a job well done as I introduce to you the working committee. Ms. Angelique C. Biscay, event chairperson. Ms. Heidi S. Bacani, co-chairperson. Ms. Kimirose R. Estacio, webinar event coordinator. Mr. Roman Carlos R. Morales, Mr. Benjoboy D. Fabros, Ms. Rhea G. Teono, event technicians. Ms. Paula Marie C. Fagmane, Ms. Ashley A. Agoncillo, Ms. Olantuji Taiwo Christiana, Ms. Jaira D. Lim, Ms. Christina Aroza, Ms. Nelanie L. Navarro, participants registration. Ms. Myla E. Santiago, Ms. Rachel O. Matibag, documentation. Ms. Osifo Isukin Excel, Ms. Amy L. Kanihira, evaluation and certificates. Ms. Rosemary Madria, Ms. Erica S. Omela, evaluation and certificates. Thank you very much, everyone, for participating. I hope we all have a fruitful day ahead. Stay safe, well, and keep learning. Have a great day.